recommendation number 5 is to consider, it's a real fancy thing called alternative pathway management. The firefighters and the paramedics in the room will nod their heads when I say this. There is a small number of people in New Bedford that call the fire department and EMS a lot. Sometimes they are people who are terminally ill and really need fire and EMS services, but many times they are people who are, without any disrespect, that are lonely or don't know what to do, or think they'll get a priority if they go to the hospital in an ambulance rather than showing up in their car. In many cities around the country, the cities partner with, many times, the local hospitals. Sometimes the hospitals will even pay for the programs, where they'll send a social worker out to meet, or a professional out to meet with the pejorative name is frequent flyer. High capacity users is a more respectful name. But they'll send a social worker or a trained professional out to meet with these people and find out what their real issue is. Is it that they're hungry and they need food? They'll connect them with social services. Do they have a mental health issue that can be addressed? Do they need to get their prescriptions delivered to them rather than going to them? It's a program that pays for itself, because not only the firefighters and paramedics will serve everyone in the community, but they want to serve people that really need it. The hospitals also have an interest in this. The hospitals really don't want the firefighters or the paramedics to bring someone to the emergency room unless they need emergency room quick care. It clogs up the emergency room, it costs the hospital money, so many times hospitals will participate in those programs to do that demand reduction. Our recommendation number 6 is to conduct a wage and benefit study for EMS employees. Again, as I mentioned earlier, the pay for New Bedford paramedics is relatively low, and they top out at a relatively low wage. There's certainly respectful wages, but what happens again is that younger paramedics, less experienced paramedics will come to New Bedford, get a lot of experience in a short period of time, and then go make more money or run less calls, or both, in another community. So it's somewhat of a revolving door for the director to try and keep all of his positions filled.